Hello, we're just letting everybody get in and then we'll get started. Thank you. Good afternoon. We're just letting everybody get into the room and then we'll get started in just a moment. I think we're at a slow down point. So I will just start by welcoming everyone. My name is Sandy Vidal. I am the co-president of the League of Women Voters and really excited to have you here today. Feel free to say hello in the chat and let us know that you're here. If you're an elected official, we'd really love to hear from you in the chat as well. But just so that you know, this is being recorded and the chat is not truly private. So just make sure that anything that you put in the chat is something that you don't mind having recorded. We're also going out on Facebook Live, so just know that not only will we be on Zoom, we'll be in Facebook Live as well. And as you have questions throughout uh, the Zoom call today, please feel free to put those in the chat and we will get those answered for you most likely at the end of the time that we have together, but we may answer some questions along the way. So I want to start with the Pledge of Allegiance. So I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. So again, all of your lines are muted and we are streaming this on Facebook Live. We're recording. Remember that the chat is open, but it is available for everyone to see. So there is no private chat. So with over 200,000 students enrolled and over 25,000 teachers and staff, Orange County Public Schools are a major player in combating the pandemic in our Central Florida region. In addition to the physical health considerations of the virus on the children and the adults involved and their families at home, the impacts are far-reaching. The mental health of students, many of whom have lost the benefits of daily socialization with their peers, students who may have fallen through the cracks left by virtual classrooms, how far behind have our children fallen and have some been advanced and graduated who may not be ready? Every child, even the youngest students, have felt the effects of the pandemic. What price will they and our community pay for these setbacks in the near term and the long term? These questions and many more are facing our parents, teachers, and school administrators. The COVID-19 pandemic has presented situations that none of us might have ever imagined, and now the challenge of addressing them are here. Today's Hot Topics panel of education professionals will share their insights and their perspective on the impact of COVID in the classroom and our community, and what should the League advocate for in the best interests of our children and our future. Our moderator today is familiar to many of you. Leslie Postel of the Orlando Sentinel is currently on the beat of Central Florida's K through 12 schools, specifically as part of the investigative team exploring the lack of oversight in private schools and receiving state scholarship funds.
I'm working on it. Bye.
I know, and I have enjoyed reading her work in the Sentinel. Before coming to Orlando, Leslie worked at newspapers in Virginia. She's a graduate of Cornell University and Columbia University Graduate School of Journalism. We're happy to have her here with us today. And I'll turn it over to Leslie. Thank you.
Hi, thanks everyone for joining us. I really appreciate it. We are going to be talking about COVID in the classroom, which I think I've written many times has pretty much, the pandemic has pretty much upended really almost all aspects of education, from schools suddenly having to buy giant containers of hand sanitizer to face mask rules to configuring how to, the classroom should look somewhat differently.
Period. It was showing up on
And
my personal page at first, exclamation point.
I'm sorry. And also just the bigger questions of what, as Sandy said, what has been the academic impact from our littlest learners to high school students, and what's going to be the fallout down the road. Anyway, we have with us Maria Vasquez, who's the Deputy Superintendent for Orange County Public Schools, Wendy Dormal, who's the President of the Orange County Teachers Union, and Karen Willis, who is the CEO of the Early Learning Coalition of Orange County, which oversees kind of subsidized childcare and the state pre-K program, so kind of early learning for our youngest kids. So I think we're just gonna jump in and get started, kind of initially talking about what was the impact initially. So maybe Maria, will start with you. Schools closed in March, but reopened in August per the governor's order, offered both in-person and online classes. So maybe talk a little, what were the challenges of doing both? And then also how did they manage on campus during a pandemic?
Well, first, thank you to the League of Women Voters for having this forum. We certainly appreciate the opportunity to share information with our community and to help advocate for our schools. So when we were given the order to open schools brick and mortar and offer parents a choice of attending face-to-face or virtually through either our innovative model or our Orange County virtual, our schools worked furiously to begin scheduling students and trying to match parents' request with the request of our teachers, who many had to work from home due to either health issues or family members who would not be safe if they were to be asked to come into the classroom. And so at the beginning, it was a little bit easier to try and schedule pure classes of face-to-face and those that were attending Launch Ed. We started off with about 30% of our families attending face-to-face, and it has gradually grown. We are slightly over 60% of our families that are now face-to-face. And so teachers who have done an incredible job of addressing both the social, emotional, and the academic needs of our students really faced the greatest challenge, especially when we were no longer able to keep the classes pure. And many of our teachers then had to begin teaching a blended model where they had both face-to-face students and those that were learning from home. So I think that really was and continues to be our greatest challenge. Certainly, we needed to ensure our facilities, our working environments were safe. And we partnered with our local Department of Health to ensure we were following CDC guidelines, that our practices and procedures were aligned. Our school board also created a medical advisory committee. And so we were able to open schools safely and continue to keep our schools open throughout the rest of the school year. We have tried to be transparent in terms of the effects of COVID-19 and what it has done on our campuses. We have a dashboard that is on our website that is updated nightly, where we have endeavored to be as transparent as possible. We created our health and safety procedures manual, and that's been shared with everyone, including our parents and our employees. The document has evolved over the course of the year, And as changes were made to that document, we have also shared that along the way. I've mentioned the dashboard that continues to be a tool where we report out our cases. Our district's communications team also developed uniform communications for our schools to use when notifying parents and staff of cases and quarantines. And that process was a daily collaboration with the Florida Department of Health to ensure that we were sharing accurate information as quickly as possible. For the most part, when we're looking at the numbers in the community compared to our school campuses, we believe we've been able to mitigate factors due to enforcing of wearing masks, our social distancing efforts, and overall procedures that align with the guidance from CDC and the Florida Department of Health in Orange County.
Okay. Wendy, maybe you can jump in there. I mean, obviously, I know teachers were really worried when the school year was getting started. A lot of them spoke at school board meetings. There were even protests. What were you hearing at the beginning, and what are they saying now? I mean, I know, and as Maria said, that challenge also of doing both online. I mean, I remember I had a teacher who told me she was literally, holding her laptop to look at the kids who were at home, but also having to look out there at her classroom. And obviously that's a challenge. But anyway, why don't you start with what you heard at the beginning and what are some ongoing concerns?
Yeah, so from the start of the pandemic, teachers were worried about schools being open safely and were concerned not just for themselves, but for the risk to students and the families they go home to in the whole community. Look, every teacher wants to be in the classroom with their students, but only when it's safe. So we spent the last year really fighting to protect the safety and health of not just our employees, but the students too and their families. So initially, the union took the district to court to convince them to disclose the names of the schools and work sites with positive COVID-19 cases. And we did that because we heard from teachers, they were concerned. A lot of them had health issues or family members with health issues, and they were concerned that they would know if there were cases at their work site or school. And still today, we do have a dashboard, but we're still asking for it to be updated all the time and to provide that information that's missing, such as the proper names for each work location, so people can make a decision. And we also worked with the district since the last school year over the summer, trying to ensure we could get an agreement for CDC guidelines to be followed and basic health and safety provisions. And because it was approaching the beginning of school and we still didn't have an agreement, we declared impasse and finally signed an agreement in December. So it's been really difficult for teachers, stressful, and not having that security of some kind of help in place, provisions that provided some safety and health guarantees. One of the things that teachers worried about was catching COVID at school. And despite the fact that the Department of Health and districts say that teachers and students haven't gotten COVID at school, they have. We know teachers that went just from their house to school and they did get COVID. We have teachers still right now in the ICU suffering from the effects of COVID. So it's been stressful. Teachers have been magnificent. They've made the impossible possible every day and just address not just their lessons, but have been compassionate and loving to every student, no matter what their circumstance. We do know that there have been over 20,000 quarantines now since the beginning of the school year and almost 6,000 cases of COVID. So that's a lot of students and teachers who haven't been in school. So that's a concern too,
Right.
like missing assignments, like Dr. Vasquez said, you know, we're worried about students falling behind and teachers being evaluated during this terrible time. We know that the commissioner did provide a waiver last week to certain students, but certainly not for teacher evaluation. So those are what teachers are concerned about.
Right, and maybe I'll just say for people who don't have kids in school, the quarantines that they mentioned, if there's a positive case, staff and students determined to have been near that person have to be home for a certain, I think it's now 10 days, Maria, is that right? Or a certain number of days. So even though those people may never get sick, they are having to switch their mode of learning. And so I think there's a worry that there's kind of a loss in that process, even though those people for the most part are not getting sick, they are back and forth from home. Anyway, let me turn to Karen. I know there's been a huge impact on childcare and early learning centers. So why don't you take us through, those places never closed, but they did see a lot of enrollment drops as parents either left the workforce or were working from home. And so what's been the impact that you've seen there? Oh, you're on mute, Karen.
And I did that intentionally because I have 6 dogs. So if you hear them in the background, just ignore it. But thank you, Leslie, for the invitation. Thank you to the League of Women Voters for including early learning programs in this discussion. As you said, when the public schools were directed to close, early childhood programs were not given that option. You know, we call ourselves early learning. Many people in the audience might understand us as childcare. But for the most part, we have been open throughout the pandemic. We have served the children of first responders, the children of other essential workers, and then just the plain folks that have gone to work as part of the daily course of their lives. In the beginning, we lost about 40% of early childhood capacity here in Orange County. That was primarily, however, the preschool programs that operated on a part day. By the end of April or so, most of the sites that were serving full day birth to 12-year-olds were back open. We've lost some folks along the way. There are still certainly a lot of stressors, but like the public schools, I think we've done a very respectable job of trying to contain COVID. There was always the belief that young children couldn't get it. That's simply not the case. We have seen some instances where some of our teachers have contracted COVID. For the most part, it was not from the children in their care, but it was from a family member who was exposed in another type of circumstance. And the other part that I would say is among our challenges is that you can't social distance and change a baby's diaper and comfort them when they're crying. And 2-year-olds, even to the best of their ability, do not understand the concept of 6 feet. So our circumstances were certainly a lot different than the public school circumstances. But I think that all in all, we were able to weather the storm. Face masks were another whole issue. We tried to really encourage folks to look at clear masks as opposed to the full facial coverings. Certainly keeping children safe was number one, but language development requires the ability to see the movement of lips, and so much of how we learn to control our emotions and we learn about emotions is through facial expressions. So that was another issue. COVID protocols have certainly added significant costs, and I'll talk a little bit more about those later. But most of our sites right now, kind of similar to the public schools, we're at about 50% of capacity. We kind of follow the public schools because a lot of the children that we care for, either before or after school or during the full day, are siblings of our public school children. So many of our sites have wait lists. We're having some of the same issues. We can't get people to come back to work. Some of our most trained people are not comfortable coming back to work yet. And it's very difficult finding replacements. I think Wendy had mentioned that in our prep call. It's just we're experiencing a lot of the same issues that the public schools are experiencing.
Okay, thanks. Well, let's kind of move on to sort of what the ongoing fallout has been. Maria, I guess two things. First, there's been a lot of talk statewide about missing students. I think you've told me that in Orange County, at least you don't think they're completely unaccounted for, but they may not be in the public schools right now. They may be being homeschooled or at the Florida Virtual School. So talk a little bit about the fallout from that, and then also maybe the academic concerns, because I know you've said that, and people statewide have said, your sort of progress monitoring data shows kids have fallen behind, particularly those who are not on campus. And there's just a concern about where kids are this year.
So, there's no replacement for face-to-face instruction with a caring professional teacher. And we recognize that many families had to make the choice to keep their children at home and either homeschool them or go through Orange County Virtual or Launch Ed. Currently, we have approximately 206,000 students, and just slightly over 60% have enrolled face-to-face. Due to the pandemic, we have seen an increase of traditional students choosing to enroll in both FLVS and Orange County Virtual. We've also seen the increase in students being homeschooled. This year, it's approximately 9,000 students as compared to 6,000 last year.
Doing homeschool?
Homeschool.
Okay.
A number of parents of students under 6 made the decision to delay the start of kindergarten. Our kindergarten enrollment is down just over 1,700 students compared to last year. So ultimately, if students don't return, yes, it could impact the dollars we receive from the state. We are working on campaigns to reach families in order to get children back in school. We understand that safety is still a big concern, and we aren't ignoring that, but we also are concerned about how they are doing both academically and on the social emotional side. We're hoping that now we have an increase in the number of adults and now students are being vaccinated. And that, I think, is bringing another sense of security, and we hope to see our numbers rise in the fall.
You are planning like a more intensive summer school, right, to help the kids that you are seeing falling?
Yes,
right?
We have an expanded comprehensive summer school program that we are going to be offering at at all of our schools. There may be a few instances where our numbers are very low, so we may combine them, but the vast majority of our schools are going to be hosting our summer enrichment programs so that we can strengthen the academic performance for the students that have experienced learning loss during the pandemic. This year, it will take place 5 days a week. Traditionally, it has only run 4 days a week, and it's only been during the month of June. We are going to expand into the month of July with the week of the 4th of July, where all of our facilities will be shut down. We are extending this to a much larger number of students, especially at the elementary level, where we typically have only offered it for 3rd grade. It will be offered K-5 students. And at the secondary level, we're also expanding it to not just those students that need to recover a credit or a course, but to those who may have slightly passed the course, but still need additional instruction.
Okay.
We are also going to work on the social emotional learning as well during our summertime.
Okay. Just a quick financial question. I know sometimes people say, well, if you have fewer students and you get less, fewer dollars, then that should match. But I guess the issue is you have a school and a system staffed right now for a certain number of students. So if you get less money, then suddenly you're looking at, you have to cut things, right? And so you're
right. And then there's also, costs, for example, insurance and benefit costs, those continue to rise. And there are some costs that are, they're not fix to student enrollment.
Right.
We are very thankful that the federal government has come out helping districts with ESSER dollars, and we are awaiting our final number and any restrictions that they may place on those dollars. But we are very hopeful that that will also help offset some of the losses that we've experienced this year during the pandemic.
Okay. Wendy, I mean, you mentioned it a little bit. Tell us a little bit more about the toll this year has taken on the teaching force, and then what you see going forward, or what your worries are going forward.
Sure. Well, we're really relieved that the district signed an agreement to extend our safety and health provisions through the end of summer school. So that's reassuring to teachers who may want to teach summer school. Of course, a lot of them, we talk about the mental health of children, but really we should think about the mental health of these teachers too. They've really been stressed and pushed to the max. You mentioned, Leslie, about having the hybrid classes where teachers were asked to virtually teach 2 classes at once. So not just are you teaching the students face to face, but you have them virtually. And it takes about twice as much from what they're saying prep time too. So they're spending more and more hours without pay, extended hours prepping for 2 classes that they have to teach at once. And they're worried about, are they reaching them both? You know, so there's a stress with that too, because of course they want to do their very best and be there for all students. Teachers also expressed, the ones with medical conditions were extremely worried when they were called back to school. The state asked for schools to open in January, and then teachers with medical conditions, ADA accommodations were called back to face-to-face and were told you can teach face-to-face or you have to resign or take long-term leave. And we talk about missing students, but I'm afraid next school year, what we're really going to have to look at is missing teachers. We had a lot of teachers retire early, resign, take long-term leave, and some have already reported that they have new professions, that they're not going to be returning at all in that capacity. So that's something we have to think about too. And in February, CTA conducted a survey after teachers were expressing stress and exhaustion from the new hybrid and returning to school. And so we were surprised by the survey results that said 24% considered leaving their job before the school year end, 6% retiring early, 11% taking a leave of absence. They worried 76% about the district not being transparent in telling them about the COVID cases. And then they expressed a real concern with the lack of social distance. And when a lot of students came back, that meant that you couldn't have that even 3-foot social distancing in classrooms. And then there's arrival and departure times when there's a big gathering of students, cafeteria times and hallway passing, and they were concerned about that. But I think what we have to think about moving forward is, you know, showing appreciation and respect to teachers, not expecting them moving forward to teach 2 classes at once. I did hear through the school board that that's a consideration for students who might be sick or something, that they could do virtual. Teachers resist that. In fact, we asked for a stipend like they receive in Volusia for doing that extra work. So I think we also have to look at the substitute shortage. Between August and February, there were 23,000 unfilled teacher vacancies. So we have to make sure that there's experienced, dedicated teachers, and that if they're not there, there's subs for them.
Okay, thank you. Well, let me switch to Karen, and maybe you can talk a little bit about the fallout for the children who you help oversee there. And you work mostly with low-income families whose children probably most need the early learning experiences. So what are your concerns, and what has happened? I know you said the numbers have dropped a lot, and you're worried that there are kids who are just home and maybe not getting much in those crucial early years.
Well, thank you. Again, a lot of the issues that both Maria and Wendy have raised are alive and well in early childhood programs. But let me start with the current kindergarten age cohort. There were 6,000 fewer assessed for kindergarten readiness this year, starting in August. And that assessment is one of the ways that the public schools uses to determine whether or not children need additional supports in order to help them be successful in school. 6,000 fewer kids got that assessment than the previous year. When we take a look at where those fewer assessments were done, many of those fewer assessments were in public schools that are in our very high-risk neighborhoods. So our concern as we look forward is it's very likely that there's a large percentage of those 6,000 children who have lost a year of service that could help them be ready to read on grade level. And that's very concerning to us. And it should be concerning to our community. Let me shift to what's happening in early childhood classrooms, because that's really where our educational experience begins. There are 4,000 fewer children in the VPK program this year than there was the previous year.
And that's the state's pre-K program,
That's
if people aren't
state's
familiar with that acronym, right?
4,000 fewer children than there were in the prior year. And we count on that program to help our children be ready for school. Not only are there 4,000 fewer children in the VPK program, but the children that are in attendance are attending less often. So the full impact for those kids that are part of it, and I see Maria, shaking her head, nodding her head, we know what that might portend in terms of those kindergarten classrooms as we look to the fall. The same can be said for Head Start and for private pay as well. It's not just the VPK program. And when you look at our subsidy program, there are about half as many infants, toddlers, 2s and 3s in early childhood programs now than there were this time last year. So we're seeing a significant number of children in our community who have, for all intents and purposes, lost a year in their educational preparation, not to mention the fact that these children have had their routines disrupted, and for very young children, attachment is absolutely critical. Their routines have been really impacted, missing seeing their peers, missing seeing their non-parental caregivers who they are attached to, and many of these children have been exposed to household stressors that we all know impact social, emotional health and well-being, not to mention learning. Again, my colleagues in the public schools see this with the children that they're serving. We see it with the very, very young children. And I predict that the impact of this loss of 1 year will be felt through the entire educational experience of these children. Let me also mention that we have implemented as an early learning coalition some programs to support the mental health of the teachers and the staff in early childhood programs. Many of these teachers and staff do not have access to healthcare. Benefits are not something that is normally offered in an early childhood program. So we have, through grant opportunities, made EAP programs available to support the mental health of the teachers in early childhood. We have also ramped up a program to put in classroom supports for teachers who are experienced, who are serving children who are coming back with high levels of behavior that is very challenging. But let me also talk about the industry for just 1 second. A national study estimates that the cost of COVID to early childhood programs has increased the cost an average of 47%. We thought that childcare was costly now. Before, it is costly, much more costly now. And in a study, the Early Learning Coalition conducted in December, 44% of the respondents indicated that if they did not have a significant increase in revenue, preferably children coming into care, that they would be closing their door in 4 months. We are at 4 months.
Okay, well, thanks. Maria, let me just circle back to you real quick about things each of them just said. How worried is OCPS about the sort of long-term fallout as young kids come in, that they maybe have missed out on those pre-K experiences? And also, as Wendy's mentioned, how worried are you about the toll on your teaching profession and that there might be fewer people willing to teach next year?
So we are, extremely concerned about the children who have not been in school, either virtually or in person, as well as those who have experienced tremendous mental health trauma, mental health concerns. Many of them are in school, many of them are at home. And we are very mindful that social emotional care needs to happen. And we've been working on that this school year, but also, over the summer and for next year. Teaching is a relationship-based profession, and schools are places of social interaction. The limited ability to have that face-to-face interaction has really reshaped teaching, athletics, band, clubs, all of those activities this year. The social isolation has increased the negative impacts, both for our students and for our employees. Wendy alluded, to our teachers, but really it's all of our employees. Many of them, having to come back to work face to face, and having members at home who they feel are in danger each day of catching COVID as a result of their coming back to work. That's a toll, that emotional toll that is placed on individuals that we need to address. We have put in place several practices and strategies. We have Mindful Mondays and Wellness Wednesdays that are provided for our school staff. We have a self-paced wellness course for our teachers. A lot of our schools have created calm rooms for teachers and staff, both in the building or virtually, in order to provide a place to relax. Youth mental health first aid is offered monthly to train staff on the signs and symptoms of mental illness. Our students can access support through the mental health counselor, SAFE coordinator, or social worker that's assigned to their school. We provide check-ins for all of our fragile students, and this takes place both face-to-face or virtually at the school level. We have partnered with community agencies that are also providing counseling support at school, both face-to-face and through telehealth. In grades 6 through 12, we have virtual cell classes, cell clubs, which allow students to connect and build social emotional skills. We also have a student services mental health page for our parents and Canvas. It provides activities and resources for our families to use at home to support mental wellness. We have a parent hotline that was created last spring. They can call to access resources and find out how to connect at the school if there are concerns. And we've also used our parent academies to share resources available to families to help address mental health issues.
Okay, well, thanks. Well, I think we've just got a few minutes left, so let me ask each of you briefly what you are hoping you will get out of the Florida legislature, or there are things you can that they can happen there in Tallahassee that might be beneficial. Wendy, why don't I start with you for that?
Thank you. So what we'd like to see is that the legislators show their action through their actions that they value the safety, health, and lives over their economic and political agendas. And what we're seeing is Tallahassee aiming its wrecking ball right at educators and public schools once again, from SB 86 to revamp Bright Future scholarships to SB 84 that would undermine teachers' retirement security. And then, of course, being heard today, SB 1014 that aims to silence the strongest advocates for students, the teachers and educators. So we're hoping that they'll expand their financial investment in the school, allocate enough funds for districts to work and compensate all school employees and provide resources for our students. And we want to see our districts and school boards have more control over their own district budgets. We want to make sure that educators and students are safe going forward through the pandemic. We don't know when it'll end. We don't know about variants, and we want to address the teacher shortage and allow qualified teachers to earn multi-year contracts and protect our freedom to voice and be advocates for our students. We're wondering why teacher evaluations weren't waived this year. And, you know, that's another thing we'd like to see because it is tied to pay.
Gotcha. How about you, Karen? What are you hoping might happen or not happen in Tallahassee?
I have 45 minutes of comments on this one, but
Okay, can you make it 30 seconds?
first off, what we need is to have the state immediately release the over $635 million that they received in December to support the early childhood industry. We're operating at 50% capacity. We need 75% capacity to even break even. And we're like hospital beds. If we're not there when parents need to go to work, parents aren't going to work. So they need that's what they immediately need to do. The second thing they need to do is look at this $2.6 billion that's been allocated to Florida for early childhood programs in January and take a longer view of what early childhood education needs to be in the state. And that view has got to be from an equity lens. The cost of childcare is more than the cost of college tuition and rents and mortgages. And every family that has little kids and needs independent childcare is paying a lot of money. But the industry itself pays poverty wages. It is extremely expensive to care and give high quality care to very young children. And if we are serious about wanting our children to be successful in their educational pursuits and in their lives, then we need to look seriously at our willingness to fund this in an equitable way and make sure that high quality childcare and pre-K programs, bear in mind, we are paying VPK, the state's pre-K constitutionally mandated pre-K program, at less today than we paid in 2005 when we started. If we're serious about our kids and serious about the chamber's view that we need to have 65% of our population with post-secondary credentials by 2030, high quality early childhood programs allow parents to work, allow parents to go to school, and allow children to get off on the right foot. That's what they need to do.
Okay. And Maria, anything you want to add as far as what OCPS is pushing for?
You know, both Wendy and Karen have stated it very eloquently. Our school board wrote a letter in March advocating that, you know, the state continue to lead with grace and compassion and that they hold our students and teachers harmless. We were very grateful and continue to be grateful for the executive order issued Friday. However, as Wendy pointed out, the teacher evaluation was not addressed. And so if there's something that I would echo more strongly is that we really want the state to revisit their direction on teacher evaluation. They have done an incredible job. They've worked miracles every day. And we know that it's been an unusual year, and to use the assessments this year for teacher evaluations is not leading with grace and compassion.
Okay. Well, we do have some questions, so let me try to get to those. One of them is what type of outreach is being done to families to get children back into school? Maybe Maria, that would be for you.
Yes, so we have had really from the start of this school year, our schools have been emailing, calling, going to homes, trying to get parents to come, back face to face, especially those that we saw were struggling. Those have continued throughout the year, and we've had great success with that. Many of our families have indicated they will be returning. And again, we have slightly over 60% that have already come back. We have seen a tremendous increase in the number of students showing up for testing that were from home. We will continue over the summer to reach out through social media, phone calls, to garner parents' support in bringing them back.
Okay. One of the questions was,
And Leslie, if I
oh,
could make-
yes. Sure.
we will be launching a campaign around childcare is open and the kinds of questions that parents should be asking now as they prepare for their children returning to bricks and mortar in the fall. What are the kinds of questions you should be asking your local childcare program to make sure that you are comfortable? I think that's the only, that coupled with a real big push from OCPS to get kids back at bricks and mortar, I think is going to give parents the comfort that their children are safe. Everyone is taking the precautions. Teachers are ready and willing to welcome these children, and the adventure awaits these kids, and we really need to see these kids back in bricks and mortar.
Okay. One of the questions was, I think I can answer this quickly, was the assessments. Well, it says the assessments are not to be given this year, but that's not correct. They are being given. And the state, and I think even OCPS is encouraging students to take them if their families are comfortable having them on campus, but they're just not going to count for the high stakes decisions like third grade promotion or promotion to fourth grade or high school graduation. And the order is only for this year. So there's no expectation that that would carry forward until next year. That's correct, Maria? Did I?
Yes,
Yeah.
and school grades, you'll be able to opt in
right.
to be able, so there aren't any penalties.
Right. Okay. And another question was, will there be vaccines offered at schools?
So we are working in conjunction with our Department of Health and some local partners to be able to provide vaccines on our campuses. We know that there is a huge need for that, and our community has expressed wanting that. So we're working on a plan.
Okay. And let's see. I think this is for you, Karen. It says, how are applications to get into VPK and early childhood care being expedited to help the providers?
Well, at this point in time, we are on open enrollment. So any parent who is applying for the subsidy program, their application should be expedited within probably 2-3 weeks at the most. The VPK program, parents can go onto the portal, get their certificate and sign up. Summer program is going to be available. OCPS is offering it at their Washington Shores early childhood site, and a lot of private providers are offering VPK throughout the summer as well. And then for the fall, we're all going to be up and ready to go as soon as OCPS opens their doors. That's when the VPK program will be opened in the fall for families as well.
Okay. There's another question. Maybe this is for you, Maria. Any projections on how this will affect high school students as far as college admissions and SATs and all those things?
I think that our colleges have been extremely cognizant of all of the obstacles our students have faced and the challenges they themselves have faced. So I believe that our students will not be significantly harmed. In fact, even in the order they spoke to Bright Futures, in-service points, community service points. So I don't believe that there will be a negative impact on not only our seniors, but seniors across the country.
Right. It does seem like my conversations with admissions officers, they are well aware of what high school students face. As you said, they faced it themselves. So the next question, also, Maria, I guess, is do you envision that Launch Ed, which is obviously Orange's online option, will be available next year, or only the virtual schools through the OCBS or FFS?
So we were on a call Friday, and Superintendent Jenkins actually asked about the innovative model, and we were told that they are looking, they're still in conversations about that. I will tell you that if we move forward with the Launch Ed model, I am strongly lobbying that it has to be pure, so that we are not putting teachers in that situation where they're teaching a blended class. And that may mean that that we would need to cap it at a certain number, but certainly it has proven beneficial. However, there have also been significant challenges for both students and teachers when it's a blended model. So as soon as we know, we will let you know. I know Miami-Dade also came out yesterday, maybe
Right.
Broward, Lake, and Osceola have come out saying they're only going to offer their virtual and face-to-face.
And just for people who maybe don't have kids in school right now, I mean, the virtual is different than what the district offered because it's not live. So you can do it at your own pace, whereas the district system, you know, you got up at whatever time and you logged into your classes at the same, and you followed the same schedule, and you did have a live teacher. So that's, and you could also take all the classes, which is a disadvantage of the virtual school, especially at the secondary level. You know, there's not the array of electives and different courses that our traditional high schools offer. So,
and Leslie, as soon as Maria knows whether or not they're going to be allowed to offer Launch Ed, we'll make a determination of whether or not a VPK virtual option would be available to people. Even though people say, you know, virtual option for a 4-year-old, it's work. It's work this year. It's not ideal. But again, we want our families to be able to access education for their children, but that will all be, ours will be predicated on whether or not the OCPS is authorized to do Launch Ed.
Okay. And a follow-up on the vaccine, someone also asked, will they be required for the 21-22 school year? But I think that would be a state decision, right?
Right. And actually, I would think they might even leave it to their local municipality at the very least. I do not foresee a situation where our school board would require vaccines for any of our employees or students.
And also they're only for students. I mean, it's only 16 and up that they even have them. So it's, most of our students would not be eligible, even just based on age. Someone also asked a question. I don't know who wants to take this. Does the panel have any concerns about a report that shows children ages 5 to 14 are leading Orange County in new COVID cases and have a 9.6% infection rate? I have not seen that report.
Yeah.
So
I had seen that in the chat, and I had not seen the report yet, but I'm not surprised. I mean, we don't know a lot about this virus, and you know, I think the more that we find out about it, the more precautions we just need to take. I know that there's been some work on a vaccine for younger children, but I don't know where they are in that rollout, but I certainly am planning to look at that study.
okay. And there's also a further question about special summer classes. I think, Maria, you addressed some of that, but it looks like also summer VPK, like, can parents with young children who missed much of the VPK year somehow get help catching up?
So we are not planning on offering many of our VPK classes. We're still finalizing our numbers. You know, as Wendy mentioned, while we're offering a great deal of flexibility for teachers to teach this summer, they can teach the entire session, or they can choose to teach just 1 month or 1 week, every other week, or partner with another teacher. there are still, you know, a lot of our teachers that are extremely worn out physically and emotionally. And so we have not had, for that level, for pre-K, a large number of our teachers that have expressed, you know, an interest, and we're still working through that. If it is offered, we will be announcing that within the next couple of weeks, and those will be at our Title I schools. It will not be offered at all schools.
And as far as private providers are concerned, there are many private providers that are offering the VPK program. There are stipulations depending upon how much the child attended, those sorts of things. But if there is a family that is interested, please contact our office and we will be happy to work with you and let you know whether or not there is a possibility for your child to have a VPK summer program.
Okay. Someone also asked if private schools are seeing an increase in enrollment. I don't know for sure. I know early on in the pandemic, they were seeing the same kinds of things as the public schools as far as parents being leery, but I have not been checked recently where they are. So I don't have any information on that. And am I missing any other questions? I think I've gotten to them, but I'm looking here. Maybe Barbara, you could let me know if there's something else that I'm missing, but I think that might be it.
Okay, I think I will take over now. I'm Gloria Picard. I want to be sure you all can hear me.
Yes, Gloria.
Yeah.
Okay, great. Hi, I'm one of the co-presidents, and thank you all for allowing me to speak. I'm in the mountains in northern Georgia, and I lost my internet connection. And so I have dialed back in on my phone, but I did want to have an opportunity to close out today. First, I want to certainly thank Barbara and Sue and the Education Committee for putting this together. We had started our new fiscal year at the League of Women Voters Orange County. It actually began April 1. So this is our first hot topics of the new year. And as part of our program plan, which is our advocacy and education plan for our league, our very first priority that's set by the membership at our last January meeting is actually pandemic fallout. And we look at that primarily from the two perspectives of healthcare and education. And I want to thank all four of you, Leslie as our very astute moderator, and Wendy and Maria and Karen, for giving us incredible insight into this issue and how our education systems have been managing so successfully, but still need a lot of additional support from us. And I'm challenging our Education Committee, which is one of our strongest and most active committees, who were very instrumental also with Barbara and Sue in putting this together. Let's pick up the mantle and be sure we're doing everything we can around this issue, pandemic fallout, as it is impacting education and our children and families in our communities is absolutely dire. And thank the four of you so much for helping us to see that. You have inspired us and inspired me, so we appreciate it. You know, this is my last Hot Topics as co-president, where our new officers will take effect on April 22nd. And Barbara Lanning and Sue Gilman have stepped up and stepped out and raised their hands and are willing to be on our slate as our new presidents as of April 22nd, when they will be hopefully approved by our membership at our annual meeting, which is next Thursday at 6 o'clock. If you're not registered, please get registered. So this is also their last Hot Topics. And Ginger Mundy, one of our very able board members and member of our league, active member, is willing to take over. She's been our chair of our new Women's Rights Committee, and she's going to be passing the torch on to other members there to take charge. And she will be one of our chairs for Hot Topics. And so she needs more help. So this is a big appeal from me, from Sandy Vidal, my co-president, as well as Barbara and Sue and Ginger, to step up like Barbara and Sue did a few years ago to take over Hot Topics when we did appeal at one of our Hot Topics sessions. So we'll be getting back face to face sometime this year. We believe that the CDC is going to give us all permission to start meeting again. And but we're going to continue doing these virtually until then as we are now. But Ginger would greatly appreciate having a co-chair. So please let us know when you can step in. We're getting ready to, as I said, to really kick off a very powerful year with some very important issues. And again, I want to emphasize the importance of pandemic fallout. We are not over this. And as a league, we have an important responsibility to our community around this. And our teachers and our administrators and our early childhood care employees are at the top of the heap of the most important essential workers in our community, along with our healthcare workers and our first responders. So to all of our teachers, please, you all, Maria, Karen, and Wendy, take the message back, how appreciative our community is and our league is of their work. So on May the 12th, it will be our second Hot Topics of the year. Barbara and Sue have worked with the community to put together a very important issue around preemption and how that's impacting our state and especially our local community. The league believes strongly in the power of home rule, but our legislators in Tallahassee have decided to take the power back to the state and usurp the power from our local communities. And really, that's where things happen in our communities. So we want to know, what in the world are they thinking and how can we fight this? So they've asked moderator Aubrey Jewett, who's one of the UCF political science professors who we are very fond of, is going to moderate a session of panelists from the Orlando City Commissioner, Tony Ortiz, and Ida Escamani, one of our league friends, who's the Tallahassee Legislative Affairs Specialist, to bring this Hot Topics to us on Wednesday, May 12th. It's going to be very lively and very informative, so you won't want to miss it. And we're going to keep doing these virtually. We're going to keep broadcasting them live on Facebook. And one of the benefits of this is that we don't have to charge a fee now, but one of the disadvantages is we're not yet face-to-face, so we don't get to have that lovely lunch that soon we hope we will be able to get back to and have some of those sessions live and face-to-face again. So I think that's all we have for today. Thank you all who have tuned in, and thank you all who are watching us by Facebook. And from the mountains of Northern Georgia, I will say good afternoon. Thank you.
Thank you. Bye-bye.
Thank you all.
Thank you.